Okay, I think we'll make a start. So welcome everybody to this Care Home Friends and Neighbours Intergenerational Linking webinar. We're thrilled that you're able to join us this afternoon. I'm Jen and this is my colleague Amy.
Hello, lovely to see you all.
Together with the National Leads for Care Home Friends and Neighbours Intergenerational Linking project and your host for today's presentation. So before we get going, we wanted to briefly cover some housekeeping with you. This is just to make you feel safe and engaged and able to participate with us. So firstly, we wanted to let you know that this is a secure platform, so you should have signed up in order to get here. As an attendee, you should only be able to see myself and Amy, and no one else will be able to see or hear you. You'll notice that we have a Q&A functionality on this webinar at the bottom of your screen. We'll be explaining how this function works at the end of the presentation, where you'll be able to submit any questions you've noted down during the webinar. This webinar also has a comments section, and we hope that you'll be freely using this throughout. Please feel free to share your organisation with people. Perhaps you have helpful hyperlinks, web pages, materials or tools that you'd like to just let people know about. So do pop them in the comments section. We'll also be using that section to share with you our web links and links that you may find helpful throughout. As we all know, things do go wrong with technology. We're hoping not today, but please be patient with us if a hiccup occurs or there's a problem. We'll be trying to fix it and back with you as soon as possible, so just bear with us if you can. Just to note, prior to you joining us today, you may have seen some supporting documentation about our work and the information on the grants available on our website. So if you haven't seen these, please don't worry. You can visit the Care Home Friends and Neighbours website, which will the link will pop into the comments section below. You'll find everything you need to know, and we'll also make the slides from today available on the website as well. Otherwise, we hope you enjoy yourself, and by the end, we hope you're eager to come with us on our intergenerational learning journey. So during this webinar, we'll be sharing with you some videos about intergenerational connections. We'll be introducing new members of the Intergenerational National Core Team and some members of our National Advisory Group. We'll also share a little bit about what Care Home Friends and Neighbours Intergenerational Linking is and what benefits are of connecting care homes with schools and youth groups. We'll also be sharing information about the new Care Home Friends and Neighbours programme linked to community engagement and intergenerational engagement, and a little about our grants that are available through the Dunhill Medical Trust.
Thanks, Jen. So welcome everyone. So just to start today and just to help us to connect to one another, we'd really like to get a sense of who it is that we're talking to. So in a moment, I'm just going to launch a poll question and it will come up on your screen that we'd just like you to answer. Now your answers will be completely anonymous. And the question will be, which best describes the target group of your current work? So young people, older people, both, or perhaps something different. So I'm just going to launch that poll now and it should flash up onto your screen. And I'll just give you a couple of minutes for those responses to come in. And I'll just give a few more seconds for the last few people. Okay, and I'm just going to end that there. And you should hopefully be able to share those, to see those results that I've shared with you. So thank you very much. This just gives us a bit of an idea as to who it is that we're speaking to. And it's great to see here that we've got a mixture of people working with young people and older people, some of you working with both. If you have answered other, it might be that you want to share just a little bit about your organisation and who you are, and if you would like to do so, then just put that in the chat. Okay, brilliant. So we just want to start today by inviting you just to let go of kind of where you are now, let go of the here and now, and think about what's possible for intergenerational work and consider those possibilities. So we're just going to share a little video with you at the moment, just to start us off. Just bear with us a moment whilst we swap screens. In this webinar, we invite you to share in our vision of young people's engagement with care homes. Imagine a world where young and older people have fun and laugh together.
Imagine a world where younger and older people interact and build meaningful friendships that reduce isolation and boost well-being.
Imagine a world where younger and older people learn from each other as they share in new experiences.
Imagine a world where young and older people have their voices heard.
We're supporting younger people aged 5 to 14 from schools and youth organisations to make meaningful connections with older people living in local care homes.
Younger and older people will co-create activities and be given the freedom to express themselves.
We are increasing confidence, boosting well-being, and developing other skills, such as leadership.
Our project is creative, ambitious, fun, sustainable, and at the heart created by younger and older people.
We want a world where intergenerational linking is an embedded activity in schools and youth organisations.
A world where care homes are truly connected to their local communities.
And we'd love for you to join us.
So we hope that this video offered you an insight into what it is that we think is possible, and we'd love to hear your reflections and ideas about your vision of intergenerational linking. So just post those into the chat box if you'd like to share something with us. Now, hopefully you will have recognised myself and Jen in that video, but it also featured some of the members of the core project team, along with our young and older people representatives from the National Advisory Group for this project. And Jen is just going to talk to you a little bit more now about the partners involved in our project.
Thanks, Amy. So I'm Jen, and I work for the fantastic organisation called My Home Life England. My Home Life England is a small evidence-based, practice-informed organisation hosted by City University of London. And we aim to enhance the quality of life for all people that live, visit, work and die in care homes. We've worked with care homes and their managers across England for over 14 years and continue to promote and support the important work and role that they have within the adult social care sector. Now, at My Home Life, we've been launching the new My Home Life England flexible programmes in response to the COVID-19 and beyond, which are available on our website. The link will appear in the comments section below now. And we've spent time listening to and working with care homes and stakeholders and partners since the pandemic started. And this insight has shaped our new approach and offers. So please do take a look at what we can do for you on the My Home Life website. As part of My Home Life's long-term vision for care homes to become the heart of their local communities, we have co-created a programme of work called Home Friends and Neighbours, which is more commonly known as Care Home Fans. Here is a little more from Tom Owen, the Executive Director of My Home Life England and the Project Manager for the Intergenerational Linking project, and he will tell you a little bit more about the history of how Care Home Fans came about.
My Home Life has been working on the topic of community engagement in care homes for about 8 years now. When we started, we were focusing very much on helping managers of care homes to reach out to the local community, recognising that quality of life in care homes had to be the responsibility of the wider society and not just the staff giving the care. And as a result of that, we started teaming up with a group of people in Essex, now called the My Home Life Essex Community Association, who were doing some work around community visiting in care homes, and then developed this concept called FANS. And FANS stands for Friends and Neighbours. And their concept was very simple. It was about recognising that individuals and private businesses and clubs and organisations all had a role to play in supporting the well-being of residents as good neighbours. Their work that came from that concept grabbed the imagination of many local authorities around the country who wanted to deliver similar projects. And as a result of that, Essex, along with the core My Home Life team, got funding, supported projects, learnt about best practice, and we've been doing that ever since. We now have a great opportunity to move into a new part of our journey, and that is about focusing specifically on helping create links between younger people and care homes. And it feels to me very timely to be doing that, given the social distancing, not only for residents, but I imagine for many younger people. Being able to find ways to connect them together and learn from one another is very exciting. So we hope that you can join our movement. We hope that you can join in the learning on trying out new things and being really ambitious about exploring what really we can do to try and forge those links so that younger people can really feel a benefit of working with care homes, and care homes can feel much more connected to their local communities and less like islands of the old.
Thanks, Tom. We hope that gave you some insight into the important work that's already passed in connecting care homes and communities from My Home Life. So if you are a care home and you're here today with us and you're excited and interested in building up your local connections, perhaps you're a school or a youth group, then please do visit our link placed in the comments section below, where you'll find our new affordable offer, which connects care homes with local communities through the Care Home Friends and Neighbours programme. This programme starts in November 2020. We'd love for you to join us. Now, if this offer doesn't quite meet your vision for community engagement in your care home or organisation, and you'd like to discuss a more tailor-made programme for your service, then please do get in touch with us. We'd love to discuss the options that might be possible for you.
So for this project, My Home Life England, who are an experienced social movement working with care homes and older people, are now working in partnership with the Linking Network, which is who I work for. So the Linking Network have expertise in working with primary and in secondary schools, and our school's linking programme brings together 2 classes from different demographically diverse schools in a year-long programme that allows children to really explore identity, diversity, community and equality. Now, the programme has been adapted to be an exciting and meaningful virtual programme for this academic year. And alongside that, we also provide training to schools and have a wealth of tried and tested resources. And our website link will appear in the chat if you would like to find out a little bit more about us. So together, the Linking Network and My Home Life England began this exciting project exploring intergenerational linking in 2019. And that's with funding from the Dunhill Medical Trust and the National Lottery Community Fund. So the project is part of the I Will Fund, which believes that all young people should be supported and empowered to be active citizens. Home Friends and Neighbours Intergenerational Linking project aims to promote children and young people's engagement with older people living in care homes so that meaningful intergenerational relationships can develop over time with mutual benefits for all. And we're doing this by linking together schools and youth organisations with a local care home for older people. Now, at the heart of this project is the want to really ensure that all voices are heard, to empower children and young people by enabling them to take ownership of these social action projects with care homes in line with the aims of the I Will campaign. And in doing so, we hope that young people will develop a long-term habit of engaging with social action. And we also really aim to ensure that the project team and those people that we work with record all of our learning experiences along the way, thinking specifically about what does work well in intergenerational linking and how can we ensure that intergenerational linking happens more often in more places. Now, if we just think for a moment here about the benefits of bringing generations together, and the benefits are numerous. So there are some on your screen here. So things like increasing confidence, empathy and understanding of community for young people. Things like reducing isolation in older people and increasing well-being. And of course, we know that there are many more benefits for both young and older people. So at this point, I would like to introduce Stephen Burke, and he's going to talk just a little bit more about this. So for those of you that perhaps don't know Stephen is the co-director of United for All Ages. And United for All Ages is a think-do tank, and they bring together older and younger people to create a Britain for all ages. And we're really fortunate on this project, as Stephen is a member of our National Advisory Group, and we're really grateful for all of his support and expertise. And for this video in particular that we're about to show you, we really thank the Together Project, and the Together Project run intergenerational activities that reduce loneliness and bring joy to people's lives. So I'll just show you this little clip from Stephen to talk a little bit more about the benefits of bringing generations together.
There is what we call an age apartheid in the UK. Many people are segregated by age, and many activities are segregated by age. So that means that many older people never come across younger people and children, and similarly lots of children don't meet older people in their day-to-day lives. There are all sorts of things that young people are missing out on if they don't come across older people. They're missing out on their wisdom, their experience, everything that they've come across during their lives. And for young people, particularly children who families are fragmented and they don't come across their grandparents very often, or their great-grandparents increasingly now, they miss out on all the things that older people can bring, as well as their experience and wisdom, but also just their life experience, their stories, their fun, and they're also people who are different to their parents. They can offer many different things which the parents perhaps can't provide. And older people in care homes can be quite isolated. Many are lonely, can be depressed. Care homes, unfortunately, can be quite closed institutions. And I think what we need to do across the country is open up care homes to other generations, bringing younger people in, different generations, just to enrich the lives of older people and bring some joy and happiness to their lives.
Brilliant. Thank you, Stephen. So as part of this project, we're really excited that we're already working with 2 organisations in Bradford and in Bristol to co-create together an intergenerational linking model in those areas. And we're gathering our learning along the way.
Great about the Together project is going to address
talking over me. Yeah, so we are gathering our learning along the way to ensure that we capture what works best in intergenerational linking. And throughout the whole of this project, that's really important for us, that we do aim to capture the impact and the learning so that we can share it with others. So share what is working well, how do participants, how would they like things to be, how can we work together to make this happen, and what needs to be in place to make this happen more of the time.
Thanks, Amy. So a bit of context to all of this, which all sounds delightful, but I'm sure you're all sitting here thinking, well, this looks lovely, Jen, if children can come physically into care homes and see residents face to face. Yes, COVID has weirdly changed everything for everyone, as we all know, sitting here working from home from our kitchen and bedrooms and wherever we are. But we do kind of want to reassure you that we, like many other projects, have spent months thinking about how this project can work well in the light of COVID restrictions and limitations in which in some places are still in force. We're ambitious, as Tom said back in his video, and we want to find ways to connect care homes and schools and youth groups which still have meaningful impact for all involved. Care homes have been thrusted into the spotlight and the public is more engaged with them at the moment, and we want to harness that good energy and keep that going. We want to build on this goodwill of the communities to support one another, and this project can support children and young people to link well with care homes for older people and help people, older people, younger people feel connected, whether they're physically in a building, whether it's a digital connection, or whether it's another kind of remote connection.
Thanks, Jen. So towards the beginning of lockdown, the Linking Network and My Home Life worked together as part of this project to create a selection of remote contact activities. These would enable young people to connect with older people living in care homes without having to have that face-to-face contact, which, you know, at the time and even now we're still not necessarily allowed to do. So we designed these to be used perhaps by parents who are homeschooling their children, and perhaps by youth groups or schools and care homes. And each one of these activities has a step-by-step instructions, it has images, and it also has an age recommendation. And you can see that there's a few kind of screenshots on them on the screen at the moment. So these are just really simple activities, but fun activities, things like making a bird feeder and hanging it in the garden of a care home, or sending a postcard of kindness. Just really simple things that can keep those connections going. So you will be able to find these on our website. The link will be placed in the comments section below, and they are freely available, so please do use them where you would like to. And Jen's going to share another example of now about a school and a care home linking during the height of that national lockdown.
Thanks, Amy. So we had quite a few stories come to us about some fantastic links made between care homes and communities. And one which caught our attention because it was intergenerational linked was the International School of London, who contacted their nearby care home, which was St Mary's Convent Nursing Home in Northwest London. And the school asked if residents would like to connect remotely. And this, as Amy said, was during the height of lockdown. And they suggested chatting with students, so older students using iPads. And the residents really enjoyed chatting to students with the help of staff using these iPads online. And this project lasted for about 6 weeks. And a member of the staff at the home explained that students spent time getting to know residents, developing relationships, and really improving younger people's conversations to older people and how that can happen. Their language developed. And what flowed from this, from previous talks, and they managed to really just have some great discussions together. Staff were also in on these calls for safety reasons, but also could step in if students clammed up a bit or needed some support, or if older people were struggling and just needed some help to understand what they were saying and share their thoughts and stories with younger people. So Jane, who's absolutely fantastic, who's the care homes activity coordinator, shared with us this quote. She said, "It was a well-received project and residents were pleased to think that they hadn't been forgotten in the chaos that reigned in those early weeks of the pandemic. Thanks to St Mary's Convent Nursing Home, it's clear that there are huge benefits of linking younger and older people, and even the smallest links can bring light to life."
Real, thanks, Jen. So we felt it was really important just to highlight some of these examples, and there are a few more on the screen again, of how intergenerational connections and activities can still happen during these challenging circumstances. And this is why our project is about establishing lasting links between care homes and schools and youth groups. And we think that at the moment, key to this is starting small with exchanges of stories, artwork, letters, videos, that kind of thing, to build up those special connections. And we hope that, or we know that COVID will not last forever. This situation that we're in at the moment can't last forever, and that there will be a day when older people and younger people will be able to spend time together again, face to face. So these projects and our projects can build as these restrictions are gradually lifted, and those long-lasting relationships between schools and youth groups and their local care homes are established. So we just want to be creative and realistic in our vision, but always striving for the very best that's possible.
Thanks, Amy. So what's really exciting about Care Home Friends and Neighbours Intergenerational Linking project, it's a short title, as you can tell, but it's really exciting because it's offering charities, not-for-profit organisations and local authorities a learning opportunity to join with us, the core team, to co-create an 18-month intergenerational projects in your local areas across England. So we're looking for organisations who are able to embrace the project principles, and these are things such as youth voice for older people and younger people being central and equal value to one another. That's absolutely core to what we believe going forward in this project. We want to co-create mutually the benefits and activities and co-create tools and materials and evaluations and project themes. A lot of what we talk about is empowering people to be included and be involved and take part. We want to be reflective, and unusual to this project is the evaluation will be throughout. So we're not going to be accumulating everything into the end. We're going to be evaluating and learning throughout this project. We want to create sustainable, lasting relationships between youth organisations, schools and care homes, as Amy said earlier. And we want to embed this project so that young people are able to long-term embed a volunteering habit for themselves, access quality opportunities of leadership, and older people will get the opportunities to mix with younger people and just enjoy each other, which is just a lovely thought to think that that's possible given these challenges that we're in now.
Well, so if you feel that your organisation could embrace all of these principles and would like to co-create a new project with us, then we're just going to talk through now a few of the essential criteria that you'll really need to know. So on the screen that's just come up then are the essentials of the local projects. Now, just worth noting that alongside what's on the screen here, the accompanying documents that Jen talked about earlier are really useful here, and they are available on the website, and we'll then link them to you after this as well. So key for these local projects then are we're working with young people aged 5 to 14 in schools and in youth organisations. Now, the reason that we're working with this age group is because we're working as part of the I Will campaign with funding from the I Will Fund. And one of the key investment drivers is to engage younger children in social action in order to build a long-term habit of active citizenship. And research has found that those who first get involved in social action volunteering under the age of 10 are more than twice as likely to form a habit of service than if they'd started at age 16 to 18. So that's why we're really working on that age group in particular. We're working with older people living in care homes, and we're linking schools or youth organisations that service less advantaged areas with a local care home for older people. And the reason again that we're working particular with trying to reach less advantaged young people is because again our funding from the National Lottery Community Fund as part of the I Will Fund has as part of its remit the opportunity to encourage social action opportunities to groups of young people who are seldom heard. Now the target for this funding opportunity and for these local projects is to engage with a minimum of 10 links. That might be that you manage to reach more, and that's absolutely brilliant, but as a minimum it's 10 care homes linked with 10 schools or youth organisations. Now, essential to our projects as well is the idea of embracing co-production and co-inquiry so that learning can be shared. Now, what I mean by co-inquiry for this project is reflecting on and sharing project learning around key questions that we're focusing on. And these key questions are: what is working well and why? How would we like things to be? How can we work together to make it happen? What needs to be in place to make it happen more of the time? And we think that these questions are really important to think about in terms of intergenerational linking, you know, whether or not you choose to apply for the grant that may be available, really important questions to be thinking about. So co-inquiry for us is about sharing project outcomes, including impact data and evaluations, in order for us to all learn together. And what we mean by co-production here is using your expertise alongside the core project team's expertise to create new ways of working and intergenerational approaches that are mutually beneficial for young and older people. It means sharing ideas, resources, templates and materials generated within this project so they can be freely shared with others. And for us, these local projects are about developing a new intergenerational linking project. So it's not necessarily about continuing or perhaps re-establishing something that you're already doing, but about joining with us to co-create something new. So we anticipate that anyone successful in accessing some of these grants and working with us would then appoint a local community broker within their organisation, and that will be the key person that will really be working to enable the relationships to develop between care homes and schools and youth organisations. So at this point, if you feel that actually, yeah, my organisation would be really interested in this unique opportunity, Jen's going to talk you through just a little bit more about those key details and essential grant criteria.
Thanks, Amy. So yes, as Home Friends and Neighbours Intergenerational Linking Project, we are offering through the Dunhill Medical Trust grants, which is fantastic too, as Amy said, start some new opportunities to link care homes, youth groups and schools. And what will be available is up to £31,000 through the Dunhill Medical Trust, and this will be expected to cover perhaps part of a salary or full salary, resources, travel and further overheads and expenses. The funding is for an 18-month project, and the project will have to have started by April 2021. So these 18-month projects will have a 6-month initial phase, which is designed to help block out time for you to co-create activities between younger and older people. So finding out what people want and recruiting care homes. The engagement will be within the next academic year, which will be 2021 to 2022. So in order to apply and be eligible, you need to make sure that you have active now an adult and child safeguarding policy, or at least one in place before you apply. And there is some guidance outline of what is required on our website, where you can find more information about what the National Lottery need for you in order to have that to a certain particular standard. The initial 6 months is also dedicated to recruiting, which I've just mentioned, around care home, schools and youth groups, but also recruiting a advisory group, which will help you through the first few months and beyond your project to help you develop and plan all the different stages of delivery right through to evaluation. And we'll be encouraging all grantees at the beginning to explore right now what is already working well in your area in terms of intergenerational work and what's happening that you might be able to get involved in. A bit like Amy said earlier, aside from the grant, if you're in a local area, it's really, really key that you always explore your networks and find out what's happening right now, what's working well, and how you can get involved. Thanks, Amy.
Thanks, Jen. So what's exciting for us, and hopefully for you as well, is that as a core project team, we're going to be working really closely with local organisations and local projects. So our role in that is that we are here to support you at all stages of the project, and we will do that by, first of all, hosting regular sharing network meetings, and this will be an opportunity to meet together with other community brokers in other organisations. And we'll share together successes, we'll share resources, ideas, working together to overcome barriers, and we'll be gathering data again at that point that can be used in the project's evaluations. We'll provide a range of templates that can be used to help you set up your project. So that will be things like letter templates, meeting templates, that kind of thing. We'll provide a range of resources that can be used in intergenerational activities, and we'll work together to create other ones as well. We'll support the communications of your project and your local promotion, and what's great is that we'll be able to share the learning that we've gained from working with Bradford and Bristol at the moment to those of you that take part in our next stage of this project.
Thanks, Amy. So if you're unsure about any of the criteria that we've mentioned, or whether you're whether you think your organisation is a good fit for this project, then we're asking you to get in touch with us. So Amy and I are available via appointment between the 12th and the 23rd of October to talk through any questions or queries you might have about the grant, about the project, or perhaps even about the programme helping to link care homes with communities. We strongly recommend that you speak to us if you're applying for the grant, as we'd love to just discuss what you're doing and how you're doing it, and whether there's anything else that we can do together. So do let us know and book an appointment between the 12th and the 23rd of October. Expressions of interest forms, so the application for the Dunhill grant, must be submitted via the Dunhill Medical Trust website by 5 p.m. on Friday the 13th of November. So that's 5 p.m. on Friday the 13th of November. So just to reiterate, in case anybody's come late or you just want a quick lowdown, so there are 3 great ways that you can interact with this project. Please pop onto the Care Home Friends and Neighbours website and get an insight into what Care Home Fans is all about. On there are free resources and materials that you can download that will help care homes to connect with local communities. More information will also be on there about the Intergenerational Linking project, including all of the grant information. You can interact with us via our Twitter handle, which is @IntergenLinking. So do use that and follow us on Twitter and hashtag us with the Intergen Linking. And that would be fantastic to see what you're all doing. Alternatively, give us a call or pop onto the City University of London website, where you can sign yourself up to our new Care Home Friends and Neighbours programme, helping care homes and others to create new opportunities to connect with local communities, including schools and youth groups. Or you can apply for the Dunhill Medical Grant. And as I said, that is open until the 5 o'clock, on Friday the 13th of November, and the link will go live once this webinar has completed.
Well, thank you, Jen. So we really hope that you found today interesting and informative, and hopefully inspiring as well. And we'd like to just thank you once again for joining us on this webinar. So what we would like to do now is give you the opportunity to ask some questions. Now, just to help us manage this easily, what we're asking you to do is to use the Q&A box, which you should find at the bottom of your screen. So if you do have a question, pop it in there, and my colleague, also called Amy, not to add confusion, will help to feed those through to us. And we'll try, in the remaining time that we've got here, we'll try and answer as many questions as possible live in this forum, so that others can hear the responses as well. But as Jen said, we do encourage you to get in touch, to book an appointment to speak to us over the next couple of weeks if you are interested in making an application, or if you have any questions that are perhaps personal to your organisation that you maybe don't want to ask here and now. And the email address to contact us are on the screen at the moment. So what we'll do now is we'll just give you a few moments to type any questions into that Q&A box if you have any. And whilst you do that, we're also just going to invite, if she's okay, Sarah Allport, and she's just going to join us as a panellist. Now, Sarah is from the Dunhill Medical Trust, and so she may just be able to support us in answering any questions about the grants that are available and the funding side of things. So just give a moment and then we'll just air some questions. Hi, Sarah.
Hi, sorry, forgot to unmute.
This is Sarah from the Dunhill Medical Trust, everybody.
Hi everyone, thanks Amy and Jen. We've had some questions come through, and we've got a question that actually might be more appropriate for you, Sarah. It's about the match funding. So somebody's asked, can the 31k be a part of match funding?
Yes, so if you have got funds from another source that you can put towards this, that will be absolutely fine. If you can just make that quite clear in the application that you have those additional funds. There is actually a file upload function in the application which lets you add more information in a Word document or PDF.
Great, thanks Sarah. There's a question that I think we've touched on, but somebody's asked, will we be circulating this presentation afterwards, which we definitely will be. We've got everyone's contact details from when you signed up, so we'll send around the slides. And I think it's been flagged as well that it's quite hard to save down links in the chat box. So we'll send a transcript along with those slides as well, so you have all the links that you need.
Thanks, Amy.
There's a question, can this be extended to include early years in school maintained nurseries?
So I think Sarah may want to jump in on here, but I think because of the way that our funding has worked in our project proposal, it is young people aged 5 to 14 that are the key target group. Now, that's not to say that you may additionally work with nurseries as well, but for our minimum targets there of the 10 care homes and the 10 schools youth organisations, it will need to be children 5 to 14. Anything to add there, Sarah?
No, that is correct. Because of the National Lottery funding, it will have to be 5 to 14, but you could do earlier years in addition to that, yeah.
There's a question to clarify some of the criteria of the grant. So is it to engage with 10 care homes and 10 schools, or is it 10 care homes and 10 classes within a school? So I think the question is it just specifically a school, or is it the class within that school?
Okay, shall I
Yeah.
take that one? So I think, I mean, what we would really like, the ultimate vision, is for each school to have that real connection with a care home, for that care home to feel kind of part of the community together, so that there's a kind of almost an institutional relationship there. Within that, however, it may be, you know, what's more likely is that it's a class or it's a year group that focuses on this intergenerational linking project. It may perhaps be an after-school club. I think that kind of will depend a little bit on when you speak to the schools and the nature of how they would like to work that. So there is a little bit of flexibility there. I don't know if any of my colleagues want to add in a little bit more there.
Yeah, I mean, well, not really much more than you said, but yeah, it's just, if you pop onto our website as well, we have a frequently asked questions paper that will hopefully be able to kind of put into black and white a lot of the questions that are being asked. But yeah, it's a total minimum target, 10 care homes and 10 schools or youth organisations per grantee that's applying for. But as Amy said, you know, there is some flexibility there, but ultimately we're quite an ambitious project, so we want to make sure that we meet our aims where possible.
Great, thank you, and thanks to everyone that's sending in questions. We've got a long list, so we'll try and make our way through them. So a question that's come in, do you have any expectations of what sort of organisations can apply for the grants? This lady works for a cultural heritage arts organisation and is interested in being a broker to work with schools and care homes. to help create meaningful long relationships between the two. So it's a cultural heritage and arts organisation.
Yeah, lovely. I can take this if that's helpful. So specifically, if you're registered as a charity in England, you are a local authority or a not-for-profit organisation, and you sit within a community, and your ambition is to link younger and older people from care homes, and younger people being from the bracket of age 5 to 14. It doesn't really matter what your background is in terms of whether you're a heritage site or whether you're a museum or whatever you are, as long as you have the status of being a charity, not-for-profit organisation or a local authority, you have, and you meet the other eligibility criteria, then you're absolutely able to join us on this journey. And we're interested in all different types of people coming in from all different backgrounds. We've had discussions with people who are from musical backgrounds and therapy backgrounds and arts, all different types of people, including museums as well. And we are absolutely interested in working with anybody that is situated and has good local links. That's key to this project, is that if you live in Bradford, like the Bradford project that we're working with, that organisation has excellent local links, and that is what we are looking for people to become hearts of the communities, both care homes, schools and youth organisations. I don't know if my colleagues would like to add anything at all to that, but no.
I think you've answered that very well.
Great, thank you, Jen. Couple of questions around the definition of local, which I'll try and group together. So please, can you expand on what is meant by local? Is it one borough? And somebody else has asked, our care home is in an affluent area. However, there are several groups about 7 miles away that spring to mind. How local is local?
Great question.
Yeah, great question. So I don't know, Sarah, do you want to take that? Is that better for you?
I can take that one if you want. We are deliberately being slightly vague about local because it's more what works for you locally. So it could be a local authority area, it could be a borough, it could be a council defined area, it could be a catchment area for the schools. It could be 2 neighbouring towns. You could group those together as local. So we're deliberately not being prescriptive because we can't get one size that fits all. So it would really be how you identify local for you.
Yeah, and if I may add, Sarah, it goes back to that whole thing of knowing your local area. So if your organisation is in Milton Keynes, then unless you've got local links in Birmingham, you wouldn't work in Birmingham. So the idea being that if you're an organisation that's in Milton Keynes, you might find 2 neighbourhoods where a school and a youth group or a care home are next to each other, and that area being in an area that's less advantaged. And we are looking at the National Deprivation Register and the Register for School Meals. Is that right, Amy? What's the formal name for that?
Yeah.
Just that. Okay.
Sorry. Yeah. Generally, because it's the less advantaged kind of young people. So so we were using the multiple deprivation index and or, depending on the situation, percentage of free school meals. I think just adding to that, I think if we think about trying to, for our links to be sustainable, ideally what would be great is if schools and youth organisations are quite close to the care home that they're linked to, so that visits things as we move forward will be easier. So I think just bearing that in mind, but I guess every local area is slightly different in the geography of things, aren't they?
Yeah.
Great, thank you. There was a couple of questions about definition of disadvantage, so hopefully that has answered your questions, but let us know if not. A question about safeguarding policy. So we have a safeguarding policy that covers both children and adults. Do we need to have separate policies?
I can take that if you like, unless Sarah, you want to add anything? No? Okay. So you have to, so as long as you cover adult safeguarding and child safeguarding, it's up to you whether you put it into one policy or 2 separate. The key to this is that it covers the National Lottery requirements, which will be available, the requirement document will be available on our website, where you'll be able to check against it what criteria is needed to have your safeguarding policy come up to a particular standard for this project. So I would say that no, you don't need two separate, but you do need to have one document that covers both, or if you would prefer, yeah, one for adult, one for children. But as I said, that document is there to support you to make sure that you've covered all eventualities. And I'd probably just also say that some really great resources out there through the NSPCC and other organisations, including the Guiding Association, around safety measures online for young children, which we realise as a project that most projects are perhaps thinking of a digital link, and therefore may well benefit from just checking up on the criteria that's now available through these fantastic organisations. CEOP, Child Exploitation Online as well, have some really great guidance that charities and other organisations can follow to help bring those policies up to standard with this new way that we're working, and we're all online connecting with one another. So do check those out, because they will help to strengthen your policies.
I think if I could just add, I think there was one specific question, forgive me, I've missed because the screen's going up and down, who actually asked it, but they said they're working, I think it was 7 to 14-year-olds, and we're aiming at 5 to 14. For that person, the fact you've got a safeguarding policy is the most important thing. Yeah. The actual age group of your younger people really doesn't matter, unless obviously your policy specifically says 7 to 14-year-olds, in which case you might need to do a minor amendment to
yeah.
that. I also noticed there was quite a few, at least 2 or 3 questions asking about partnership working, and if people who are in this virtual environment can partner up. Absolutely, we would love to have people working in partnership. The only limitation on that is we can only award the grant to one organisation, so you'd have to decide amongst you who would be the lead applicant in that regard and who would hold the grant monies. But definitely, please do partner with one another to share our expertise and our learning, and we'd very much welcome that.
Mm-hmm.
Thank you, Sarah. A clarification on care homes who are eligible to be involved. So is the grant available to all care homes or just not-for-profit? We have a number of homes that take a high proportion of residents who are funded by local authorities. Yeah,
I can take this if you like. So if you are looking to be awarded the grant yourself, then you would have to be a not-for-profit organisation in order to apply, or have a charitable status, or be a local authority. However, if you are partnering with somebody else in your local area with the idea that you wanted to be part of this project, and you know a local community charity that would be perfect for them to be the host and you be involved in it, then that would probably be your key way in, so that you could still take part if you're an enterprise-based organisation, so that your residents could still benefit from the connections between young and older people. But if your care home is registered as a charity or not for profit, then you would be able to apply for the grant. And the grant is only you're only able to apply for the grant if you're based in England. So if you're a care home based in England. There was another clarification actually that I just wanted to make, that we're not asking everybody to work with all 5 to 14-year-olds. If you can target the entire range, that's fine. But if you just wanted to work with a particular key stage, or you had a particular connection to a group who only worked with 10-year-olds, then that would also be fine. So it's just to clarify that you can work with the full range of 5 to 14, or just a particular age group.
I think if I could just add to that, Jen, there was a clarification specifically about Scotland. Unfortunately, my home life, England, their remit is England, which is why we've had to limit it. However, and Jen, you can correct me on this, there is a My Home Life Scotland, and
yes.
in My Home Life Northern Ireland, and in
yes.
My Home Life Wales.
Yes, we're international, yeah.
If any of you out there are in those organisations, please do contact Jen. She'll be able to put you in touch with those representatives. They are all doing intergenerational linking, and they would very much welcome you contacting them and getting involved that way. And there was a follow-on question about the role of researchers. I'm sorry, yes, we wouldn't be able to fund a university. However, I think the people interested in this would very much welcome a researcher being involved and being on their advisory board. So I think it's Helen Kingston's made that offer. Definitely, that would be the way to go.
Great, thanks very much, Sarah. A couple of questions about the project. Is the focus here on project delivery or creating models or approaches that can be applied more widely? And then a second one, somebody's asked, we say it should be a new project, but could it be something that has been trialled with just one link? So for example, in one care home and one school group. So one about project delivery and one about can it be something that has been done before, but in a small capacity?
Should I take project delivery, Amy, and you take the other capacity one?
Yeah, absolutely, you start.
So we have been back and forward about this within the focus of this project, but it's become apparently or abundantly clear that what we are trying to do is to capture the learning around how sustainable connections can be made between care homes, youth groups and schools. So that is the how. So the model being of interest. So for example, we've had models where people have connected, as I said, through arts, and that has been their model because that is what younger and older people want. But the model is dictated by the wishes and wants of older people and younger people. So for example, considering what they're doing in Bradford, in Bristol at the moment, for example, they're considering whether their project can capture younger and older people's voices and what they want to do, and whether that could be themed around an environmental cause, perhaps. So whether it could be what's important, asking the questions, what is important to you as an older person about your local environment, and asking the children the same thing, and then perhaps working on something together that they could collaborate on. So perhaps having a thought in your brain about what your expertise as an organisation might be and how you can weave that in to what younger and older people might want may be a way forward. But I think the idea is that we would be capturing and working with you what worked well when you addressed older people. Did you speak to them individually? Did you speak to the care home as a whole? Did you involve relatives? How did you do that? Was it through digital means? Was it a letter writing and letting people know what you're doing? How did you connect with older people with living with dementia? How did you work with the school? You know, what did they do? How did they connect with their younger children, and how did they convey the project to them about working and meeting older people, and what does that feel like and what does that look like to them? So that's what we're really interested in, because at the end of this project we want to be able to share with other people the how, the what, the who, the where, the when. You know, what is it, what worked best when thinking about linking older and younger people, and what does that look like for the future, and how can we embed it long term, and who do we bring on board to make that happen more often in more places more of the time. So that's kind of what we are doing. So I'd say it's a blend of both. We are looking to both capture how we're doing it and what works well, and then looking for those innovations that happen when you work with younger and older people about what they want and how they want to do it. Is there something that you wanted to say about older and older models of working?
Yeah, I will do, and then I'll just I'll build on to that next question. Yeah, so I mean, exactly as Jen has just said, but I think also through our work with Bradford and Bristol, we are kind of developing like a framework, a model almost of what this intergenerational linking, the outline could be, and that's also based on the principles that are kind of evolving as our project goes. So we talked about in our principles about empowering all of those people involved. So for us, we know that actually engaging first of all with the staff in care homes and in schools and youth groups, and offering some training and some support to start with is crucial to, you know, the project then moving forward. We know that as a next stage, it's important to prepare young people to, you know, engage with care homes. So there's certain work to be done there within the classroom or within the youth group first of all. And then projects can build in terms of building relationships, and there may be, you know, that may be a next stage, and then young people start to engage a little bit more in taking ownership of the project. So that kind of framework, a loose framework, is being developed at the moment, that we can share as we move forward with this. So just that to add to what Jenna said, really. And then in terms of the question that was about, we talked about it being a new project and co-creating. and somebody I think had said they trialled some things with one care home and one school, and I think that that's absolutely fine. I don't think we would consider one care home and one school necessarily an established project that you that you couldn't then. I think we would see that as, okay, you've trialed something and now actually we want to co-create that and move that together, and I'm hoping that Sarah will agree here in terms of the funding. But I think if you've trialed a few ideas with one care home and one school, then absolutely you can then build that into move it forward.
Yep, definitely. Scaling up, and once you've done it once, being able to scale it up and replicate it, because that allows you to share the learning wider. So yes, we would definitely support that.
Yeah, and Sarah, I've just noticed there's a question here about the KPIs for this project. I'm just thinking about, is it a good time to sort of talk about the lottery requirements for local projects and the numbers that we're requiring?
Yes, certainly we can do. So the data collection and evaluation on the care home side of it is going to be very much co-produced with you. Our primary aim is to make sure that we capture sufficient learning and best practice and share that, but we don't want to overburden the community brokers or the participants, and particularly the care homes, because they have enough on with their day-to-day activities without also doing evaluation. But unfortunately, on the National Lottery side, they do require some metrics to be collected. That is because they have to report to Department of Digital Culture, Media and Sport, because it is state aid. It is very limited, though. It is literally down to counting the number of younger people, and they've got it down to the barest of questions. You have to provide it 3 or 4 times a year, and there's a very simple spreadsheet for you to complete and fill in. So that would be the only other requirement.
Thank you.
Great, thanks very much, Sarah. Thank you to everyone who's sending in all your questions. We'll try and get through them all. We've had a couple of questions in actually around the definition of a care home. So let me just find it. Somebody has asked, could we be looking at supported living accommodation rather than care homes? And I think there was one posted into the chat. Could we work with over 55 residential accommodation with communal space, i.e. in the lounge? Does that fall into the definition of care home for this project?
Yeah, so for those that work in social care, you'll probably already know this, but for those that don't, the definition of care homes can get quite complicated because there are variations of what it means. But for this project specifically, we are saying that it's a care home for older people, and I'm sure there's lots of people who are going to be really miffed with me for saying this, but it's 55 plus, which is very young, we know, but 55 plus, a care home being a residential home or perhaps a nursing home. If you have a care home that's 55 plus and is a residential status with the CQC, so it's down as residential dementia care home, that's fine, or a nursing home, that's fine. For sheltered schemes, supported living, extra care, it doesn't fall, unfortunately, into the right bracket for us. We are specifically looking for residential or nursing homes 55 plus for older people. So unfortunately, that doesn't exclude you in terms of the housing scheme itself, could learn from what's going on and certainly be involved, but the numbers that we would be making up would be with care homes for older people. So if you had the 10 care homes, that would be the 10 that we would be recognising within the project, with the additional 3, I think it was that someone was saying about extra housing schemes or housing schemes. That's up to you if you want to involve them in this process. Nobody's excluded, but we would be only looking at the care homes for older people and residential care. Again, in the frequently asked questions, that is included in a more eloquent way. So do look up on our website, and that will give you the full lowdown of what the definitions are for this project.
Great, thank you, Jen. I think it would be worth just saying a little bit more about what we mean by community broker. There's been a couple of questions around the definition and what a community broker means for this project.
Shall I take that, since that is me? So when we talk about the project that we're already working with in Bradford, that's actually me as the Linking Network, or the Linking Network is the organisation. So part of my role at the moment is working together on this core project, and part of my role is working in Bradford to develop a project and to engage those 10 schools and 10 care homes. So my role for that is, as Jen was saying, so I've done a lot of research around what's already happening in Bradford, around care homes in Bradford. We already work with a lot of schools in Bradford, so that's really great. So kind of be engaging some ideas from those people, working on establishing an advisory group so that we can gather together key people within health and social care, within the educational sector, that can really help support this project and help support me and the linking network together. And then my role is, as Jen was saying, about actually recruiting schools and care homes and youth organisations, so having conversations with them and engaging with them. And my role then is also about working with those staff that will be involved and offering some training and some support and some ideas and some activities to help start those intergenerational links and to help support those people in the care homes and in the schools and youth organisations to really try and capture what it is that their young and older people want and where their project can go. So that's kind of a brief summary of the kind of things that I'm doing within that role as a local broker. And as we said, some of that funding money could go towards the salary of somebody in your organisation who would be doing that. I hope that answers the question.
Yeah, it's like your project lead. You're the enabler, and you're making these relationships happen.
Yeah.
Great, thanks, Amy. We've had a couple of questions come through about sharing contact details with everybody who's attended this webinar. What I think the best thing to do is, when everybody signed up, there wasn't an option to share data with the group. So if it's all right with everybody, we'll send an email back round to people afterwards, and if you could just give us your consent to share details with everybody who's visited today, then we'll be able to recirculate a attendance list. So just let us know whether you are or aren't comfortable with us sharing your details, and I think from that it might enable people to see who's also working in your local area if you are interested in local partnerships. So hopefully that is satisfactory. So we'll send around an email and let us know if you're comfortable sharing details.
Great, thanks.
I would just, whilst you're looking for the next question, Amy, I think I would just say thank you to everybody who's out there and who we can see things in the chat, and we can see your discussions and people linking to the work that they're doing, and I think that's really great that we can share what's happening together. And I haven't had a chance to click on any of the links at the moment, but it will be really interesting to go and do that after this webinar and see what people are doing and what people are saying. So thank you.
Yeah. I just add, if people don't know, you can actually save the chat and then access it offline afterwards, so you don't have to frantically click on all those links and have your browser full of tabs.
Yeah, thanks, Sarah.
It's really exciting times. I think everybody since March has been, it's been terrible, hasn't it? And it's really difficult for schools at the moment. Teachers are tired and are catching up from the terms missed, and care homes, as you know, in the press have been, absolutely devastated in some places. Others have done better with COVID. And I think when you talk about linking younger and older people together, and you show those pictures as we did at the start, it brings absolute joy to people and energy, both to the older people and younger people. But what we've been discussing lately is the ripple effect that it has. So residents and relatives are finding it really difficult to connect at the moment because of the restrictions, but if their loved one is seeing if the relative is seeing their loved one enjoying time with younger people and are being engaged, that's just fantastic. And it gives that older person energy, it gives the relative comfort, and the young people are accessing living history of older people, and younger people have got so much to offer and surprise older people all the time in these links. And I think that the opportunities to be creative here are vast, and although these restrictions may last for 6 months, 9 months, the projects won't actually be starting, as we said, perhaps until to the 2021-22 academic year. And so there's plenty of time to start developing those exchanges between younger and older people with letters and postcards and digital, calls and whatever it is, and really establishing those relationships so that when they do meet, what a joyous occasion it will be. And it's enough social action. What you're doing there is linking the two, the care home, the youth group and the school. That in itself is social action, and that's what we want from this project, is to bring light to life for all people that are involved, including parents and relatives and staff and visitors and others that are around those spheres of schools and care homes and youth groups.
Are there any other questions, Amy, that you think we could answer here? I think we did mark 5:30 as a finish time, so we've got a few more minutes if people have still got questions. But it's fine.
Thanks, Amy. Yeah, there's some similar themes coming out, one around co-creation. So this is more of a statement than a question, I guess, but somebody said we have to ask older people in the care homes and younger people what they want to do. Which is true, but I don't know if anyone wants to elaborate further on that. But yes, that is what we are asking as part of a core part of the project.
Yeah, I think we've covered that. How you do that is up to you. But as Amy said throughout the presentation, you won't be alone in trying to find that out. That is exactly why we've got the sharing networks in place, so that we can all connect and share best practice of how we go about finding out what older people and younger people want. That's why this partnership between TLN, the Linking Network, and My Home Life is here, because of the experiences that we've had and the expertise of which we can reach to help you to understand how you make those links as good as they could possibly be, and find out what those two groups want to do together.
Yeah, and we will support with there can still be structures in place and still allowing older and younger people's voices to be heard. And I think sometimes it will depend on who you're working with and who the older people are and who the younger people are, as to how it is that you draw out their voices. There's different level of structure that can come in there, but absolutely, as you say, Jenny, you won't be alone. We can support in that process.
I see one from Liz just saying, can you just clarify, is it 10 care homes, 10 schools and 10 youth groups? No, Liz, it's 10 care homes and 10 schools or 10 youth groups. So only 10 care homes, but it's up to you whether you choose to connect with 10 schools or 10 youth groups. That's completely up to you, or a mix of both, schools and youth groups.
Got a question around other support that the core team can provide. So what support can the core team give projects, for example, dementia, expertise support regarding dementia?
Shall I take some of that, or do you want to take some of that?
You start and I'll chip in if I've got anything.
Okay.
We're a dream team, aren't we, Jen?
Dream team. Yeah, I mean, it's a great question, and we will do our very best to support you in any which way you want. I mean, part of it is almost like within the sessions that we'll be bringing people together in your sharing networks, we'll be sharing expertise. So we'll be looking to the others within the group to sort of say, well, we've got a fantastic tool that's worked really well, and we'd love to share it with you to see whether it works well in your area. Same as if nobody had anything, then as an older people's social movement, we absolutely have access to dementia training and opportunities for you to build something of your own locally. And I think TLM, with their experience, the Linking Network, with their experience working with younger people in schools, absolutely would do the same as we do, which is ask you first and ask those that are surrounding you within that sharing network about their expertise and what they've trialed and tested. And then we would also be able to offer you their expertise as the connectors of schools and younger people, and resources that we've tried and tested, and we can link you to other organisations.
Thanks, Jen. A couple of questions about the budget. Quite a specific one as to whether iPads could come out of the budget, and a broader one about the community broker role. Is that provided by the core project team, or do we as an applicant resource it out of the 31k?
Sarah, do you want to take that one?
Yep, I can quickly answer those. Yes, you could include iPads in your budget if you're going to be using those, or you think you're going to be using those. And you would, the community broker salary would be coming out of the grant, so you would need to source and cost that yourself. That doesn't come out of the core project team. No.
Yeah.
Just seeing a grant, just seeing a question here, just in relation to, whilst we're still on about grants and funding, someone asking about how many grants there are. So I think we said there are up to 10 grants available, didn't we, Sarah?
Yep, up to 10, yes.
Thanks, Amy. Question about local areas. Says lady works for a care charity, 10 care homes, 3 housing schemes. The would be to coordinate each home or scheme with a group, class or school. So can it be UK wide, not 10 in a local area? So I think the question is around what we mean by local area. Can it be 10 links across the country, or does it need to be within a certain geographical distance? I think
this is a care charity.
Annabelle that's asked that question. If that's
Okay.
right, Annabelle, if not, please send us another question and we'll clarify it. But I think that's the case. It's about
So it's a care charity where they have multiple
homes across
care
the
homes.
country.
Okay, yeah. Right, okay. Sarah, are you best placed to answer that?
Yeah, I think we would actually prefer it to be more local than that, just because fostering the community spirit and the way it's going to work. If we have a national chain with homes all across, or 10 homes across the country, it could get quite difficult, and it's very much place-based as well, what we're trying to do. So our preference would be for it to be in one specific area. So if you could maybe pick one of your areas, yes, so yeah, if you applied for your home area, yeah, your home and local area, or even the area where you've got the most number of care homes, because that would help you reach your target. But either of those, Annabelle, yes.
Or pick the care home that you feel is most ready for community engagement is also a key thing that we talk about a lot here, is readiness to engage. So when you're working with care homes or schools or youth organisations, we talk about readiness to engage. So if people are facing other issues within their service, whether that be within the school or elsewhere, then possibly speaking to them first and establishing what that is, and then working out whether it's an appropriate time to connect, will also mean that you'll get the best possible relationship with them going forward, with the younger people and older people mixing. When other people are facing trials, it's very difficult to make that an established relationship to make it work at its best. So yeah, we talk about state of readiness quite a bit in the documentation as well. So do consider that in your grants.
Thanks, Jen. So I think we're down to the final question that's been asked through the Q&A function. But if anyone has posted a question in the chat that's missed, if you're able to resubmit it through the Q&A function, then we should be able to see it. But otherwise, we've got a question that says, could part of the project be involved in doctoral research, but it wouldn't be paying for the research as it's doctoral studies? So I'm assuming this question means, this question is from Olivia, correct us if we're wrong, Olivia, but are you saying, could the outcomes and findings from your project inform doctoral research?
Okay.
Yes, perfect, thank you.
Amazing, isn't it, this technology?
Yes, I think the answer would be yes, wouldn't it? Yes to Olivia's yes. That if you can take the learning from this and incorporate it into someone's doctoral studies, which means that they get their PhD and become an expert on intergenerational linking, absolutely, we'd love that.
Yeah, Olivia, connecting to either Amy or I, because the Bristol group have already got interest from another lady who's doing a PhD who's going to be using some of their examples for hers. So let us know, either Amy Locke or I, through the relevant addresses, and we'll get back to you about how we can link you into the project.
Great, thank you, Olivia. So I think that's it for questions asked through the Q&A function for now. Just wait a few more seconds to see if any more pop in. But otherwise, I'll hand back to you, Amy and Jen. Oh, we do have another one. Are you prioritising areas of multiple deprivation opportunity, such as opportunity areas, or any other geographic area? Thank you for that question, Rob.
Do you want me to?
Sorry, yeah, Sarah, do you want to answer that in terms of prioritising?
At the moment, we are not, because we don't know who's going to be applying from where. What we will say is that we won't be funding 2 people in the same area to ensure that we get good geographic spread. Until we really see what applications come in and where they're from, it's a bit hard to answer this. But at the moment, we don't have any prioritising criteria that we're using. We're very open to see what comes in from where. Like I said, the only limiting factor is we won't fund 2 people in the same place, purely because we don't want 2 intergenerational linking projects fighting over the same group of care homes. It gets messy.
Thanks, Sarah. Thanks, Amy Simpkins and Sarah, for joining us on that Q&A. It's really helpful to have you both there answering those tricky questions, and also Amy sort of collating them into groups. That's really, really helpful. And thank you to you all for joining us this afternoon. Remember, the Dunhill Medical Trust Care Home Friends and Neighbours expression of interest forms are now open, and we do hope that you'll submit an expression of interest form. Before you do, please make sure you speak to Amy Locke or I. Appointments are available between the 12th and the 23rd of October to discuss your ideas, or perhaps answer any questions that we didn't manage to get to in the Q&A today. Thanks for joining us. I hope you enjoyed it. Get excited. It's exciting times, and we would love for you to join us. So we'll see you again soon. Take care of yourselves. And yeah, keep in touch with us.
Thank you, everybody. Really lovely to have you all here.